Hi Catherine, my name's Bianca Rose, student ID number 3119360, and I'll be discussing with you maternal and child health. When I read over the details for this assessment item and saw the words historical and contemporary health issues affecting Aboriginal, Torres Strait Islander and non-Indigenous Australians, maternal and child health was the very first thing that came to my mind. Before I begin my presentation, I would like to acknowledge the Ngunnawal people, the traditional owners and custodians of the land in which I sit today. Maternal and child health nursing is provided to pregnant women, infants, children and families. Registered nurses who have an extra qualification in midwifery and/or child and family nursing provide these services. The focus within maternal and child health nursing teams is to work in partnership with women and families to provide information, education and health advice in order to deliver supportive nursing care to all people. Just over 500,000 Aboriginal and Torres Strait Islander people live in Australia today, comprising fewer than 3% of the Australian population. Although many Aboriginal Australians have a good standard of living, too many remote living people experience unacceptable levels of disadvantage in living standards, life expectancy, education and health. Current data shows a wide gap between the Australian Aboriginal and non-Indigenous populations. Australia has committed to closing the gap between Indigenous and non-Indigenous Australians, with maternal and child health as a particular area of concern. Australia is a wealthy, developed country and considered to be one of the safest in the world to give birth. Despite this fact, there are extraordinary disparities in pregnancy and birth outcomes between Aboriginal, Torres Strait Islander and other Australian women, reflected through the following information. Throughout my research experience, there were many eye-opening health issues that affect both Indigenous and non-Indigenous people, some being fetal alcohol syndrome, the misuse of drugs during pregnancy, insufficient use of prenatal, antenatal and postnatal services, and diabetes in pregnancy. I have chosen to direct my focus on the insufficient use of prenatal, antenatal and postnatal health services and diabetes in pregnancy. For new mums, the thought of having a baby is exciting, overwhelming, and a range of other emotions. The use of prenatal, antenatal, and postnatal services ensure pregnancy, birth, and baby are taken care of. Prenatal care includes general health advice for mums and dads-to-be, as well as simple do's and don'ts to ensure a healthy pregnancy. Antenatal care ensures mum and baby are regularly monitored to ensure specialist intervention is sought early if required. Once the baby is born, postnatal visits offer support, advice and medical input to ensure the questions of a new parent are answered. As majority of us are well aware, in Australia, access and use of health services by Aboriginal people is less compared with other Australians. When comparing Aboriginal and non-Aboriginal babies, antenatal visits, hospital admission during pregnancy, pregnancy complication, pre-existing medical comorbidities, length of stay in hospital following birth, birth weight and gestation show significant variance. Current literature and data will be presented to show how significant the variances are between Indigenous and non-Indigenous circumstances. Of women who had no antenatal visits recorded, the mean gestation was 34.8 weeks, whereas those who had at least one antenatal visit, the mean gestation was 37.5 weeks. 23% of Indigenous women required hospital admission at least once during their pregnancy. Pregnancy-related admissions were primarily related to preterm labour, threatened and actual, as well as early labour at term. Among women who received prenatal and antenatal care, the most prevalent medical complications were identified as anemia, abnormal urine test results, and sexually transmitted infections. 34% of women had pre-existing medical comorbidities. These included cardiac-related complications, diabetes, asthma, and autoimmune disorders. Following women giving birth in a hospital, the median length of stay was 4 days. 19% of newborns were preterm, Mean gestation was 37.6 weeks, and mean birth weight was 2.998 kilograms. Whereas following women giving birth outside of a hospital, predominantly in a remote community, 36% of births were preterm. The mean gestation was 36.2 weeks, and the birth weight was 2.726 kilograms. Following birth at a regional hospital, 15% of women who were admitted were then discharged without their babies, as 1/3 of infants required admission to the neonatal nursery, mainly for preterm birth and low birth weight. As you can see, there are significant health issues surrounding prenatal, antenatal and postnatal care for Indigenous women in Australia. It is important that not only do we as nurses encourage the use of these services, but educate Indigenous women and families on the importance of these visits to encourage safe and healthy pregnancy and infants. Diabetes in pregnancy includes diabetes mellitus gestational and pre-existing diabetes, either type 1 or type 2. Another significant health risk for Indigenous women. Diabetes in pregnancy increases the risk for poor maternal and infant outcomes, such as emergency caesarean section, low birth weight, and newborn hypoglycemia. The longer-term risks for poorly controlled diabetes are the effects on the risk of obesity from 14 to 16 years of age, metabolic syndrome, and the development of type 2 diabetes mellitus. Whilst diabetes in pregnancy is a maternal risk for women in general, there are additional risks encountered by Indigenous women due to low socio-economic status or by belonging to an ethnic minority. The prevalence of diabetes is documented at 7.1% for non-Indigenous Australians. 6.4% is gestational and 0.7% are pre-existing type 1 or type 2. Aboriginal women are reported at 10.7% for diabetes, with 8.4% being gestational and 2.3% being pre-existing type 1 or type 2. It is possible that these differences are due to inadequate services being offered to Aboriginal women during pregnancy and during delivery. Due to the impact of maternal and child health on the general population, enhancing this is a key global health issue and a significant focus for the worldwide public health strategies. While improvements have been made in health outcomes for mothers and infants globally, Indigenous people worldwide are still experiencing much poorer maternal and child health outcomes compared to those of non-Indigenous culture. The significant gaps in health and well-being equity between Indigenous and non-Indigenous populations in Australia, as in other settler colonial countries, have been well described as evidence of the achievement of health targets which have shown where it is possible to improve health. After reading and exploring the data and literature regarding maternal and child health, it is obvious there are actions that need to be made in order to provide equality in healthcare for all women. Unfortunately, there is no quick fix to this worldwide issue. However, there are some simple ways in which we can work towards closing the gap between non-Indigenous and Indigenous Australians. The development of trust and trusting relationships is crucial in the development of a therapeutic relationship. Trust is gained through providing non-judgmental and professional healthcare. Through trust, advocacy is also gained, meaning the health professional supports and directs the patient to the healthcare they require. This can sometimes be difficult in the case of Aboriginal women, as they may experience cultural unsafety in processes of receiving healthcare. Cultural safety is a vital aspect to nursing care, and remaining open-minded and non-judgmental is essential by nurses. Efforts to improve the health of Aboriginal and Torres Strait Island Australians must encompass their holistic definition of health, which includes the social, emotional, spiritual, and cultural well-being of an individual. Additional factors that must be incorporated include Aboriginal and Torres Strait Islander people's obligations to their land, their culture, and their people, as well as the avoidance of situations that can cause shame.